All right, good afternoon to you and you're welcome to the program. It's Good Afternoon Ghana and we're coming to you live from the studios of Ikea Boahima. My name is Annie Ifwa Ampofo. Now, this afternoon we're focusing on health. And you know that for some years now, government after government, what we've been doing is trying to make the National Health Insurance Scheme accessible for persons who have difficulties in funding their health care services. And this afternoon, we're actually trying to focus on some of the issues that have come up. There are some hospitals or health facilities who have decided not to offer the National Health Insurance Service any longer because they're not being paid. And also, some private health facilities are also holding some demonstrations indicating how it has been difficult for them to apply the NHIS or the National Health Insurance Service. We're going to go into the details of it and speak with some members of parliament who are on the health committee. We'll have Kwabena Minta Kando, who is on the health committee, and also Akwesi Kunedu, who is also on the health committee. Other two members from the health facilities will also join us on the platform, so we'll have about 4 guests. When we come back from the break, I'll give you the details of these guests who will join us, and then we'll kickstart the discussion. If you have any issue also with NHIA or NHIS, you can text it to the production number, and we probably will try and capture it during the program. Let's take a breather. We'll be back. Welcome back to the program. So it's Good Afternoon Ghana, and as I said, we're going to be dealing with some issues that are coming up within the health sector, precisely the National Health Insurance Scheme. We will have some stories, but first of all, let me introduce a few guests that have joined me in the studio. I have Frank Tobru Richard, who is the General Secretary of Private Health Facilities Association. He's already with me. You're welcome, sir. Good afternoon to you. Thank you for your time. And I also have another guest with me, Joseph Tete Afangbe. Am I correct? Okay, and he's a founder and executive director of Young Visionary Leaders Ghana and co-convener of the Ghana Social Accountability Platform. Obviously, we know that they will help us hold our leaders accountable. Are they actually being able to do that? All right, let's go for a quick summary of a story put together by the producers about the success or the failures of the NHIS so far.
Fana is an island community in the South municipality of the Greater Accra region, trapped between the sea and a lagoon. The only way to access the community is by a canoe. The residents, many fisherfolk, with no access to electricity, water, and basic amenities, also lack quality health care. They often risk their lives sitting in canoes without life jackets for over an hour to reach the nearest health facility. 22-year-old Christabel Ayakple is a resident here. She became severely ill in February this year. With no canoes operating at night, she waited for over several hours before one came her way, enduring severe pains, putting her life on the edge. At Botiano Polyclinic, she was referred to the South Municipal Hospital, popularly known as Akaway, and also to the Kolebu Teaching Hospital. At Kolebu, her insurance card was of no use. After treatment, she was detained for days until her parent paid almost 2,000 Ghana cedis as cost of the treatment.
On February, I was not feeling well, so they had to pick me to a nearby hospital at Botiano, which is called Botiano Polyclinic. When we get there, they can't diagnose me, so I had a transfer to Weja Hospital. When I get there too, they can't treat me, but they gave me some injections. So I was given a referral letter to Kolebu. So when I went to Kolebu, I was admitted for 3 days. But I thought that the health insurance would have covered something, but like it was not.
Christabel's ordeal is similar to that of millions of registered Ghanaians under the NHIS who are compelled to pay cash for treatment. 56-year-old Julius Jojegbe is also a resident of the island community and has now resorted to unorthodox means for treating his waist pains, even though he is a subscriber of Ghana's health insurance scheme. Julius is yet to visit any health facility because he is unable to foot the bills for his treatment.
Tankoye Julius Jojegbe. Mi lafia goya malafia of bla and alaba yentomaho of bla tovoda. Ta nya heavy insurance lashia. Akana mera kojia ma wodo. Nemi kojia ni okonama chike okonama yentoma fly ma half.
The several categories of healthcare facilities accredited by the National Health Insurance Authority to provide services to subscribers are now losing their cool as they haven't been paid their claims for 8 months. According to them, several attempts to have the Ministry of Health and the authority address their grievances have failed. They are vowed to soon operate a full cash and carry system. Frank Toblu Richard is General Secretary of the Private Health Facilities Association of Ghana.
There are some facilities that are already out of NHIS that I'm very much aware. They are completely out. If you take your card, NHIS card to those places, they will tell you, please, you either go and bring cash and we serve you, or you don't come here. It's as simple as ABC. There are some that are already getting out, and more are likely to get out.
A report by the Parliamentary Select Committee on Health shows how successive governments have failed to credit the National Health Insurance Fund with monies generated from the 2.5% National Health Insurance Levy and a 2.5 percentage point of Senate contributions per month. The minority in Parliament has said the National Health Insurance Scheme faces imminent collapse due to the delays on the part of government in releasing funds. Kwabena Minta Akando is ranking member of the Health Committee of Parliament.
The President is actually collapsing the national health insurance. It is also the President is not on top of issues. The people who write his speeches and people who brief him, they don't brief the President well, and they always subject the President to ridicule.
Until the government takes steps to reverse the worrying trend of non-payment of claims to service providers, many subscribers will continue to pay hefty sums for treatment. Ghana also risks failing to achieve SDG Goal 3, which enjoins countries to ensure good health and well-being for all if ordinary citizens cannot afford basic health care through the National Health Insurance Scheme. Henry Kwesi Bedu, Metro News, Fan.
And that was a brief report, captures, a snapshot of exactly what's happening with the NHIS as some health facilities are already struggling. Let me welcome the guests who are with me in the studio already, Frank Tolobu Richard and also Joseph Tete Afangwe. But let me also remind you that there was a release from Sen Ghana. It says that not all revenues generated from NHIS levy are credited to the NHIF, that's the National Health Insurance Fund, all right? So a report by Sen Ghana on citizens' assessment of social protection delivery in the country has revealed that there are enormous liquidity challenges facing the National Health Insurance Scheme, and the organization's analysis of NHIS previous budgetary allocations and spending between 2015 and 2019 demonstrated that not all the revenues generated from the NHIS levy are credited to the National Health Insurance Fund. Now, the NHIS largely depends on the fund, which is 2.5% levy, goods and services collected under the value-added tax VAT to finance its operation. And every time you go and buy from a shop where they provide receipts, just take your time and go through. You see the NHIS levy that you're paying, so you expect that it operates in any health facility that you're also working from. Now, to where Frank is coming from, that is the private health facilities. There was a press release. It says that picketing at the premises of National Health Insurance Authority's premises. Let me get to you, Frank. Tell me about this.
Yeah, thank you very much. If you'll agree with me, we served the police a notice, ostensibly to go and do picketing at the premises of the National Health Insurance Authority. This is actually to draw their attention to the fact that the healthcare service providers are at their knees begging for funds to enable them provide quality healthcare services to the people in this country. Now, one may ask, why picketing? There have been several attempts to demand money from the National Health Insurance Authority, and we were actually not making any headway. We've had series of meetings with the National Health Insurance Authority. They also made a lot of promises purposely to calm us down so that they'll be able to find a way to make payment to us. But along the line, we realized that the situation was getting out of hand. Some other regulatory authorities started zooming on us aggressively, particularly SNIT, GRA, started zooming on us as healthcare service providers in the country. So we thought it wise that, of course, this is one government department that owes us so much amount of money. And there is another government department also demanding so much amount of money from us. So we presently are the middle, not knowing where to go. So we want to get Ghanaians involved, everybody who enjoy healthcare services in the country, aware of the fact that healthcare service providers are truly suffering. So we got a police permit, and we had 2 days more to go for the picketing. And the health insurance authorities called us to an emergency meeting. Now, this meeting, they made us aware that they were going to do everything possible to get the money for us. And they give us a date. And
that's to clear all the backlog.
To clear the backlogs. Apparently, they made it clear to us that to clear the backlog straight away was going to be very difficult for them because they also do not have the money from the government to pay us. So they were going to pay 2 months, 2 months, 2 months, so that in the nearest future, the amount involved would have been cleared, which, of course, we saw through, and we considered it as one of the most appropriate positions taken by the NHIS, and we agreed to that. So as we speak to you, we have given them time frame within which, if they are unable to fulfill that obligation, we will have no option than to go back to what we have agreed to do earlier on.
Let me go on to the Zoom link because our lines, are playing funny. So let me try and engage them before it begins to misbehave. Honorable Member of Parliament, Minta Akando, is a ranking Member of Parliament on the Health Committee. And also Akwesi Kunedu is also Member of Parliament, and he is equally on the Health Committee as well. Honorable members, thank you for your time. You're welcome. Good afternoon.
Good afternoon.
Okay. I can see Akwesi Kunedu, honorable member. So you're welcome. Okay, Honorable Akando, I can see you as well. You're welcome as well. Good afternoon to you. And all the same, congratulations to the landmark event that happened in Parliament last week. But let's focus on health. Honorable Akwesi Kunedu, let me start with you. Where is the money we've been paying for NHIS services?
Thank you very much, and a very good afternoon. And let me greet my senior and ranking member on the Health Committee. If you ask me where is the money that I've been paying for the NHIS fund, the money is routed through the Ministry of Finance and sent to the NHIS for them to use in their services and the provision of healthcare services for the people of Ghana. So if you ask me where is the money, I would simply say the money is with the NHIS, passed through the Ministry of Finance.
So we can say that the Ministry of Finance is the one that is failing to pay into the NHIS or credits the NHIS fund F.
First and foremost, I think before we say that, we must probably be able to follow the processes that some of these transactions would have to go through. We obviously cannot say just at extempore that they are failing to credit the NHIS fund. But we probably must understand what the processes are, because upon receipt of these monies from taxpayers, either through the 2.5 levy or through the SNIT that we pay, those monies would be deposited into the consolidated fund before disbursement can be made. There ought to be verifications of all of these things and proper accounting and due process done before these monies can then be released to them. So you probably just cannot halt and say that they have failed or they failed or they are keeping it. We might just follow the trail. It might end up that the monies will not be released on such timeless basis that we all think it should be. But there are circumstances that may inhibit that. And that probably will not be a deliberate action to be done, that we aren't, or the finance ministry aren't going to release those monies.
Let me engage the ranking member, Minta Kando. You were the one that my colleague spoke with in Parliament, and you clearly stated that this government is actually collapsing the NHIA or NHIS, whatever it is, either the authority itself or the service. On what grounds were you making those comments? Because listening to Akwesi Kunedu, he has indicated how the processes the fund must go through, the monies must go through before it eventually is credited into the fund.
Let me say good afternoon to your viewers and say that the challenges that the National Health Insurance Authority is going to go through in 2023 is going to be bigger than what they've gone through before. And the short description of the status of the National Health Insurance at the moment is that if care is not taken, we are heading towards a collapse. And I say so because, and let me put it on record, that the woes of the National Health Insurance Authority must be put at the doorstep of the Ministry of Finance. Because the law is clear. The National Health Insurance Act is clear that, I keep saying that, Annie, if you even buy water, you go to the restaurant to eat, you pay National Health Insurance levy. And so once the government collects the levies, within 30 days, that is what the law says, within 30 days, these monies must be lodged into the National Health Insurance Fund. So we have absolutely no reason to wait until it goes beyond 2 months, 3 months, under some circumstances, even as long as 10 months, 7 months, 8 months. There's absolutely no, tangible excuse to that effect. And so, for example, the 2023 budget indicates that we are going to raise an amount of 5.2 billion Ghana cedis in the name of the National Health Insurance Fund. But if you go to the expenditure column, what they say is that they have allocated about 2.5 billion Ghana cedis. Annie, let me thank you, Metro TV, for throwing more light onto this matter. And let us not end here. If you take 5.28 billion Ghana cedis in the name of National Health Insurance Scheme, you must simply use 5.28 billion on the National Health Insurance Scheme. In fact, this is the health sector. And so why do you take 5.28 and then you allocate only 2.5 billion? What are you using the rest for? You and I, we don't know. Are you following the
I'm
argument?
following, right.
Very, very good. So the government is giving the National Health Insurance Authority less than 50% of what they have collected or they are collecting in the name of National Health Insurance Authority. This is where we must start from. Especially so when your inflation is above 50%, when your cedi is depreciation at a very fast speed, then you are giving, in fact, in 2022, the allocation was around 2.7 billion Ghana cedis. And in 2023, the allocation is 2.5 billion Ghana cedis. Meanwhile, you've earmarked to collect 5.28 billion Ghana cedis. What are you using the rest for? In any case, it is government who should rather invest in the health sector, but you don't siphon money from the health sector. You don't do that. Annie, as though that is not enough, the formula we approved for the 2022 fiscal year, we are told that not even 1 Ghana cedis have been released for the year 2022. And Annie, get me clear here. You know, immediately you say this, they will come out with a document and say that after all, in the year 2022, we gave money to the National Health Insurance. So get the explanation well here. Now, every year we approve the formula. So, for example, in 2022, you are expected to pay a certain amount to the National Health Insurance Authority. Now, if you give money to the National Health Insurance Authority and it is the arrears, you don't say you have given money to National Health Insurance Authority with respect to 2022. So whatever National Health Insurance they have received in 2022 up to this year is an arrears. And as I speak to you now, the arrears is almost 2 billion Ghana cedis.
From which year?
Clearly,
from which year?
The whole of 2022.
From 2022.
Not the whole of 2022.
Wow. Okay.
Not even 1 Ghana cedis was paid. Not even a cedi was paid with respect to 2022. So that is where the problem is. So we are in 2023. So they are now going to pay, if anything at all, they are now going to pay the amount of money they owe in 2022. So by the end of 2023,
but is it not illegal to fail to pay or to credit the fund when the money has been collected already? Doesn't the law, create, as Akwesi was, talking about the procedures? Is it not illegal to collect the monies and still not credit the fund?
The law is clear. It is illegal. It is unlawful to keep the money beyond 1 month, as far as the law is concerned. But you see, the practice has also been that they try to, go through the processes from 1 month to 3 months. That is probably understandable. But you see, as we speak to you now, even from the National Health Insurance Authority themselves, they are saying that they have paid up to August 2022. Some health facilities are even saying that they have been paid up to June and July. But even based on what they have given us, the information National Health Insurance Authority has given us, they have said that they have paid up to the month August. So what happens from August till date? So the whole issue is very, very complex. And you see, the reason why we should hasten slowly to blame the authority is that from where I sit, from the documents they have submitted to us, the money is still with the Ministry of Finance. So not until Ministry of Finance releases that money, they cannot do the onward disbursement to the service providers. So that's where we are.
Hold on there.
Honorable
Akwesi Kunedu, can you hear me? Am I audible?
Yes, I can.
So what are these procedures you're talking about? That should we go by what the NHIS is saying that they have paid up to August 2022? What has happened to the rest? What kind of procedure are we going through that is making it difficult? It's as simple as you have collected the money, credit the fund.
Anita, thank you very much. And I like a word that my ranking member used. He says the process is complex. Annie, my ranking member talked about a budgeted figure in the budget. Budgets are estimates and expectations of receipt that the government would want to have. They are not actual funds. Mm-hmm. That one must well be established.
Right.
If we budget, say we would want to collect 5 billion, it doesn't mean the government is collecting 5 billion. Let me give you a classical example. In the year 2022, that is last year, they budgeted to collect in excess of 2.6 billion Ghana cedis, 2.6 billion. But the actual collection was 1.9 million, 1.9 billion. Mm-hmm. So you probably now cannot use the 2.6 billion as the figure to be used based on any releases that would come. Because if I budget and I don't get that, I cannot in any way pay what I have budgeted for. So that must well be established.
I completely
If
agree.
we don't establish that, we would always be juxtaposing releases to budgeted figures instead of the reported collections. Because the reported collections are the money that are due. Which was not collected, could not be collected, was not money that was due. So if my ranking says that in the year 2022, no amount has been paid to the National Health Insurance. You see, I agree there are challenges with the National Health Insurance. I agree they need money. But when we are trying to speak to these matters, we probably would have to speak to them. Because if you release 2 billion in the year 2022, and the reported collections for that same year per the records is 1.9, that is in excess of the amount that was collected in terms of taxes and revenue towards the NHIS in that same year. So you probably cannot say that no amount had been released towards the same year of 2022. That's not saying, yes, I agree, that most often than not, these amount of monies that are paid are in arrears. Because as we speak now, yes, almost all the teaching hospitals and some of these regional hospitals have been paid up to August. Subsequently, they are paying the rest in 2 months. They are paying the rest other hospitals. So there is a backlog of almost, probably if you take away the 2-3 months lead period where they used in doing their claim assessment and the rest, we are looking at in excess of almost about from August to December of last year, and probably say January, that's statutory, they ought to be paying. This is a concern. This is a worry. But Annie,
how many months do we have of arrears do we have to pay the backlog? How many?
If you had to go by the figures that the National Health Insurance gave us just about last week up to August, we are looking at from September to December. That is, we are looking at 4 months in last year,
4 months.
Say 3 months in this year. But however, the National Health Insurance always has a lead period of about 2 to 3 months where they vet claims that have been submitted to them. So you probably can say tentatively they are owing 4 months of last year, and this month will probably be for the period of reconciliation. But Annie, it is important to note and say that although we are talking about these budgeted figures, the National Health Insurance technically will look at all revenues that they ought to receive in trying as much as possible to do their formulas and the expenditures and provide these services and that include premiums. For a period of about 6 years now, premiums haven't been increased. But however, these service charges, these operational costs in terms of payment to suppliers and the rest, for the framework drugs and the rest, have all been increased. Somewhere around last year, July, there was about 30% increment. Somewhere around February of this year, there have been about a 10% or 15% increment. There have been increments in terms of the amount that they pay to service providers. And if you are static at one point where the 10 ought to fall in the kitty, but where you are supposed to take it out, there have been constant increment in those ones, which even still do not meet the standard upon which these service and private health providers would have wished for. It tells you technically there will be a shortfall that would create this vacuum where payments will not be sufficiently made towards the National Health Insurance providers. So we agree there is a challenge, but holistically, we must be able to come to the table to help the National Health Insurance, because it's one authority and one service provider that this country cannot see or help to fail. We must all bring hands on deck to make sure that we make it survive. And I agree, whatever approach that we would want to go to be able to help so that the National Health Insurance survive is a point that we all have to go. I know that there is capping on the National Health Insurance revenue mobilization. That is where myself and my ranking and all members on the committee are now trying to fight so that that capping will be removed so that the entirety of the full amount, whether budgeted or reported collections, therefore can be generated towards the National Health Insurance operations in terms of claim payment, so that at least the ordinary Ghanaian, for whom and for us that the National Health Insurance Authority was set up, will benefit from that. So whilst I agree that these challenges are there are delays in payment and the rest, we must also agree that the challenges cannot solely therefore also be blamed at the doorstep of the authority, neither also even at the finance ministry, although the occasions of delay may come from there.
All right,
Annie,
hold
can you
on
hear
there.
me?
Let me engage Joseph Tete. Joseph, you haven't spoken, but I wanted to engage those who are directly in charge of the questioning in Parliament, so that you get a fair idea of what's going on the committee.
Yeah.
What do you have to say after all that? I mean, he
Yes.
is asking who should be blamed.
Yeah, so for me, I think the government, the challenge here is the government not being able to, timely release the NHIS, fund or the levy for it to be used. And for example, as Director was speaking, he mentioned that what has been released is the arrear from 2022. So if you are able to get the timely release of the fund, then it will be one way or the other solving the challenges that we are facing now currently with regards to the National Health Insurance Scheme. So probably for me, I think it's a collective or individual contribution that we all supposed to do, not only the government, but then I think there is more into it, for us to be able to.
No, let's be fair to the issues. When you say it's a collective, yes, we have already played our role.
Annie,
Yes, Honorable
Annie, can you hear
Jabuso.
me?
Sorry?
Can you hear me?
Yes, I can hear you.
Can you hear me now?
Yes.
No, can I talk now?
Yes, you can.
You
Just
see,
a moment.
not until we deal with the issue dispassionately, we won't have solutions to it. You, Annie, you have nothing to do with respect to the payment of national health insurance claims. And no Ghanaian has any role to play. Let's speak to the issues as they are. Look, you and I, you have paid your money to government. Government has taken the money.
Actually, that was the point I
My
was coming
colleague
to.
was saying that. Can you hear me?
I can hear you.
Okay, so you were speaking about expected figures as regards to budget and what have you. Listen to the figures very well. And nobody has any role to play again. The money is with Ken Oforiatta and he must bring it. Listen to the figures. In the year 2020, these are collections, rare collections. In the year 2020, they collected 2.33728 billion Ghana cedis in the name of National Health Insurance Scheme. Annie, are you there?
Yeah.
Good. In the year, sorry.
2021.
Yes. So the release as per 2020 was 790.29 million, not even up to 1 billion. So, you think I should repeat it?
No, it's fine. Go ahead.
Good. Now 2021. So the difference was about 66.19%. That is the difference that government didn't pay in 2020. Now, the year 2021, they collected 2.056, so about 2 billion Ghana cedis. And they paid only 127 million.
Actually, I wanted to show you.
They paid only 127.47 million. And their standing was about 93.8%. Now, in the year 2022, the actual collection was the money that government has taken. This is not about the expected figure or any budgeted figure. These are real actuals. The actual collection for 2022 was 1.944.91 billion, almost 2 billion. Now, these figures excludes the capping. So government takes a chunk of this money before the reported collection for what must go to the National Health Insurance Authority. Now, so if you add these figures, you realize that the scheme will be in arrears of not less than 6 point something billion Ghana cedis. So if in 2022 they released only 2 billion, what it means is that there is still an arrears of more than 3 billion. We have not come to 2023. Mm-hmm. You understand? Mm-hmm. So at the meeting, which we held on Saturday, they said that this document they have given us, they prepared us at the end of December 2022. And therefore, they have received some amount of money. And I asked them a specific question that, okay, if today the Ministry of Finance is ready to pay you, how much do they owe you? And they said they owe them 1.944 billion Ghana cedis. This is not the money that somebody is projecting.
So, okay, let's see if he can rejoin. That's Kwabena Mintah Akandor there, a member of Parliament for Drabos and also ranking member of the Health Committee. Is our question still on? Okay, so I was with you. Conclude, and then I can come to Frank here.
Yeah. So,
he's made it clear.
Yeah.
From I think your start was a bit rough because, as far as I'm concerned, I have paid.
Yeah.
I have contributed. Okay, I'm told Akando is back. Honorable Akando. Hello. Can you unmute? Hello. Okay, so let's wait for him as he unmutes and then right. Joseph.
Yes. So what I mean was that you and I, contribute towards this scheme, towards the levy, and once we contribute towards the levy, then it is our responsibility to ensure that the government, does the needful. Mm-hmm. The government doing the needful is we, arising to make sure that the right owners, who are the beneficiaries, of course, who are the people on the ground, get to understand the issues or the challenges that we are facing. Once we are able to get those people involved, then I believe that with, awareness creation, education, and then probably, campaign can also help, solve this issue. Because sometimes, in a way, we as he mentioned that the government or the Ministry of Finance has this amount of money down, but then the money is not being, released on time. And even what has been released so far is not up to what was supposed to be released. So I believe, from my point, that once we all play a role, like as we are doing right now, it's a role we are playing. So it's up to us to ensure that the right owners understand what, is happening from the ground, the challenges. So from there, from the civil society organizations, perspective, we believe that the government should also render an account to the right owners. So as a member of the Ghana Social Accountability Platform, what we do is to ensure that, we get the government.
So at this point where he has made the calculation right from 2020 through 2021 to 2022, where I think the highest gap of non-payment was 93%. Yeah. What is government using the money for? And you want to still sit and do armchair request of educating us on what is happening? Where is our money? Is that what you want to do?
No, what I mean is that, right from the grassroots, I'm talking about the grassroots, people, the right owners, the beneficiaries from the grassroots. So once they also understand what actually is happening, then they also be willing to also contribute towards the core. So now, for me, I think that the government is supposed to do what
because at this point in time, our contribution to the NHIS or eventually the fund is not to convince us to pay. We are being made to pay. We are under obligation to pay because you don't buy something and decide to pay or not to pay.
Exactly.
It comes with a price. So if we are forced to pay, then the institutions that are responsible are forced to credit the fund. Do you get my point? Yeah. Honorable Akando, if you can make your final words, I can hear you now.
Good. Thank you very much, Annie. So you see, we must push this agenda aggressively. We should not treat anybody with kid gloves. Annie, it is very painful. You see, you are even not looking at the fact that government is taking 5.28 and government is seeking to spend only 2.5 on the national health insurance. Where is the money? And nobody seems to answer this question. And nobody should deceive himself or herself that we must go and appeal to government, that government is doing. Since government takes the money and under the law, there's nothing like 2 months or 3 months. The law says that within 1 month, you must lodge the money into the fund, assuming that the 1 month is even not enough. So you are going through a certain procedure. Let me admit that. Once you go through that procedure, you must, before you even present another formula for the subsequent year, you should have finished paying the previous year. Now there's an NHIS of almost 2 billion. You have not paid, and you are bringing a new budget. And even, Annie, if you look at the budget they are bringing for 2023, they have clearly set out to fail. Because if you go to item 1, for example, in 2021, in 2022, they said that they were going to spend about 1.6 billion on claims in 2022. Now, in 2023, you have revised the drag list. You have revised your tariffs. You are looking at the depreciation of the cedi. You are looking at the inflation. Yet, National Health Insurance has budgeted 1.6 billion for claims, just like last year. So we'll come back to the same point. And they must work within what you have given them, because you have taken a chunk of the money. A chunk of the money. And after capping and taking a chunk of the money, the small amount of money left that you are supposed to pay them, that one too, you let it run into arrears multiple years. We are killing the scheme. And that is where we should say it as it is.
Thank you. Hold on there. Akwesi Kunedu wants to say something about the figures. Are you there, Honorable?
Yes, I'm here. You should go ahead.
Yes, Honorable Akwesi Kunedu. Okay.
Yes, Annie.
Right. So
Yes.
you can go ahead.
Oh, yes, the figures matter was what I talked about, the projected budget, the actual releases. That is where I talk about.
But for the purposes of record, Honorable Akando clearly
I'm not talking about projection here.
Yeah, no. He didn't talk about projections. He talked about actuals.
No. Actuals.
Yes,
and we both hold the same. We are holding the same document. So, but since you know, pretend as though he doesn't have this document. He has it.
All right. Yeah, go on.
You have this document. Refer to it. Page 9.
I do. I am not saying the National Health Insurance doesn't have
table 4.3.2. Because you look at that table.
I am looking at table 4.3.2. And
good.
Yeah.
You see, when you talked about those releases of 790 million, 127 million, and the 0.00 million in those years, these are amounts that are released in specific reference to the year itself without any release. Yes. If you look at table 4.3.4, actual cash receipts by the NHIA in those years, that is different from table 4.3.2. Because if you look at 2020, where table 4.3.2 tells you...
Stop confusing yourself. Stop.
I am not.
Stop that.
You see,
stop that.
And these are the figures. These are the figures. Because if you look at the table that you talk of senior, you talk about that table in 2022, 000. But last year, even if the amount was in payment for arrears, there was an amount of 2 billion that was paid.
It's what I'm saying, that Annie, are you there?
But the amount of more than 2 billion he's talking about, that's the 2.5 billion he's talking about, is what was paid from the 5.28, which was actually collected.
Fantastic.
No, wait. Annie, if you want to go that extent, then you have to be looking at table 6, 4.3.4.
For
and
what?
just suppose that table with 4.3.2.
Annie, let's take our time and look at the tables well.
Yes, we can. But what I'm saying is that yes, there is arrears that the finance ministry ought to.
It's an opportunity for all of us.
No, it's an opportunity, and that is why I'm coming.
It's a very big platform. Let's allow the listeners to follow the figures well. Annie, are you there?
Yes, I'm here.
Are you there?
I'm here.
Very good. Listen to it again, and let's see. Take his document and follow me.
Honorable Akando, hold on there.
Yes.
Hold on. Honorable Akwesi Kunedu, do you have the figures with you?
I have the figures.
So can you take us through the actuals you can see on your table?
Fantastic.
2020.
We have 4 tables here. And we have 4 tables here. 4.3, and it's 1, 2, 3, and 4.
Good.
On the first table, the table will talk about budgeted collections as against reported collections.
We are not talking about budget.
So the budget, and what was actually collected.
If you can
The second
leave,
table would
kindly leave the budgeted ones. Take us through the actual collected from 2020 to 2022.
And how much was paid in that particular year.
No problem. And in that one, we are going to look at table 4.3.2.
Yes, go ahead.
4.3.2 would give you the exact amount that has been reported as collections in the respective year of 2020, 2021, 2022. Those are the figures. And you have against actual releases from the Ministry of Finance. And those ones will give you 790 as released, 127 as released. And in that same year of 2022, it gives you 00 as released.
But you're not giving me what was released as against what was actually collected. As Honorable Akando stated, because if you say you want to, challenge the figures, then you want to tell me what figures you have in terms of collection.
Let's take 2020. Let's take the year 2020.
Yes.
Reported collections were 2.3 billion.
That's exactly what he said.
Yes, releases for the year for that 2.3 billion was
799, right.
That doesn't mean that was the total amount of releases to the NHIS.
That's the point he's making.
Yes, but if you go to table 4.3.4, the actual the actual cash receipt in the year for the year 2020 was 2.3 billion. And let me tell you one thing: if it was only 790 that was released to NHIS in the year say 2021 or 2022, if you go to the same document that we are all holding and you go to the budget in page 18, actual claims that were paid in the year 2022 is 1 billion. Those are the claims that were paid actually. So it cannot be said that in that same year, that is the only amount that has been released.
But hold on. But who are you deceiving? How do you tell me that the claims you paid was more than 1 billion, yet you capture in the table of what was paid into or credited into the fund as 799, which was less than 1 billion?
That is where
who prepared the document?
Table of 4.3.4. And wait, go to table 4.3.4. It will tell you actual cash received in the year. Who received that actual cash in the year? And under those period releases in Ghana millions, in the year 2020, 2.3 billion.
Right.
In the year 2021, 1.3 billion. In the year 2020, the 2022, that is last year, 2 billion. And I am saying these are monies in total that have been received in the year. It doesn't mean, and I must agree and admit, that those amounts relate directly to the year,
right,
and the collections,
right.
But you see, the monies that juxtapose itself to the actual year. For instance, if you go to the year 2022, you see there is a 00 there, but they've been paid for the actual year of 2022. That collection of 1.9 billion,
right,
and 80 million Ghana cedis.
Honorable Akwesi, let's leave it here. I'm eating into the time of another program.
There are backlogs in payment, and this is the platform for us all.
Yes,
the national health insurance.
Yes,
but when we are doing the figures matter, it must be done in such a way that clear understanding must be had.
Right. I will, yes, Honorable Akando, I will do this again.
Can you give it this last opportunity? Just give it this last opportunity.
5 seconds, please.
No problem. You see, this government, the deception in this government is legendary. This is what they do. They owe the previous years. So they owe 2020, they owe 2021, and then they have not paid anything in 2022. So in 2022, whatever money they are paying in 2022 is not with respect to 2022, but it's on arrears.
Right.
So when you ask them, you are not paying for... Can you hear me?
Yes.
So when you ask them, but why are you not paying the 2022? They say, we have paid money. But that money they have released in 2022, in actual fact, it's not for 2022, it's on arrears.
Yeah.
But that is not in doubt.
You understand?
Right.
So that is not in doubt.
I get you.
So any money they have paid in 2022, as Kwesi is referring to,
right? I appreciate that clarity.
Was paid in 2022.
Right. I appreciate it. We'll do it again and maybe engage the NHIS itself and see what they will also say. Let me come into the studio and have my guests.
They cannot speak to it. They are all appointees. Everybody's afraid.
I appreciate where you're coming from, Frank. Give us your final words on the information you have gotten so far.
It's very unfortunate that you have given them too much time, and what really the issues are on the ground is now going to be a tail to the whole topic for discussion. I am not quite happy about that. Because with all these English they spoke, it's just about grammar. The practical situation is what we are experiencing, all right? What they were saying, receive so much, release so much, the figures are here to speak for themselves, okay? And we are going through the hell as I speak to you. Now, earlier on, I mentioned to you that some regulatory authorities are on our neck, okay? Taking most of our clients to court.
Wow.
SNIT in particular. I am not kidding at all. SNIT as an institution, GRA as an institution are taking our members to court for their inability to pay SNIT contributions on behalf of their staff and then PAYE to the government. Let's ask ourselves. The very institution, I'm coming over, the very institution that is GRA, collecting these monies, National Health Insurance Levy money, for and on behalf of the government, sending this money to the Ministry of Finance, finally into the consolidated fund, had not released this money to National Health Insurance Authority for the healthcare service providers to be paid.
Okay.
And yet, you have the gout
Okay.
to take the healthcare service provider to court. Under what circumstance?
So
are we at their mercy?
Producer, you know that you just have to give us some more time because these issues are
you
quite
at their
sensitive,
mercy?
especially it's
This is a
relating
very
to
serious
health.
case, and
so I apologize. I apologize because there's so much as far as this issue is concerned. But we'll make time again, and then we can get into the details.
It's
of those
unfortunate,
who are,
my sister.
Yes,
I must
yes,
be
yes.
very honest with you. As I speak to you, even some of our hospitals are being disconnected for not being able to pay
their
for
bills.
electricity. And the question, therefore, is what happens to the ordinary Ghanaians?
Yeah.
Ordinary Ghanaians who is at our various hospitals trying to receive medical services.
Yeah.
Are they to die at the mercy of a politician?
So Frank Toblu is Richard is actually the General Secretary
What are
of
we
Private
talking
Health
about?
Facilities Association. We had Honorable Minta Kando for Joboso constituency ranking member.